These were funds that were provided to ESD Nursing by the Bush Foundation. And the title of the grant is called Lighting a Spark in South Dakota, and SPARK stands for Serving Underserved Populations Through Advanced Care Planning, Respect, and Knowledge. The grant was provided to us in order to start conversations that can be pretty uncomfortable about end-of-life decisions in South Dakota. So what we're trying to accomplish is we're trying to spread information amongst the underserved South Dakota population. So we're specifically targeting rural areas, West River, East River, all over the state of South Dakota. We're also looking at minorities that may be living in South Dakota that also have a need and maybe have restricted access to information about advanced care planning. The advanced directive is not the end all and be all there. An advanced directive is very important, but it seems it's only one part of a process. In fact, it is our understanding that advanced care planning may change throughout an individual's lifetimes as the individual's relationships change. So does their advanced care plan, and that the advanced directive may have to be updated.
I work with students, and the first thing we start with is understanding the importance of developing an advanced directive, an advanced care plan. And we talk with students, and we also work with community members. And so we stress that the importance of having an advanced care plan is it increases the quality of care, specifically at end of life, and also decreases the expenses of the health care, and increases the community involvement in health. And then also it increases our provider satisfaction, because we've had the conversations already about our end of life care that we request. So when they see the provider, that there's less time needed by the provider to spend on these conversations because the population is already educated about the topic. And so that's the importance of the students and the population being educated about advanced care planning. From our population end, we work with students and community members, and we do training sessions through the Gunderson Foundation, and we do facilitator training sessions. And so our students and community members have joint training sessions, and they learn about the language involved with having end-of-life conversations so that they can have these conversations with their patients and with their family members, and then also with fellow community members. So populations that, when we're talking about people in the community, maybe parish nurses, social workers, anybody in the community that's interested in working with the population and having those conversations.